Okay.
Yes, yeah. I chose to become a specialist nurse because it gave me the opportunity to specialize in one area, have greater insight, and develop my knowledge in that specific area. It is a very rewarding position to be in. I would say to anyone who's considering to become a specialist nurse or a specialist nurse practitioner, follow your dreams, go for it. There's so many opportunities out there where you can make a huge difference to patients' lives. Yeah, thank you. Okay. I chose to become a specialist nurse because it gave me the opportunity to focus on one speciality and be able to see through the patient journey, and also to see the outcomes on the other side that you don't get to see if you're based on the ward most of the time. I would say to anyone who's considering becoming a specialist nurse, follow your dreams, follow your ambitions. It is a very rewarding position to be in, and also a privilege, because it's a privilege that not many get to do.
That's great. Excellent.
Okay. With the new cancer hospital, the future is absolutely exciting because there will be a lot more research that will be taking place. Our patients are going to be receiving the best care in the world, and we anticipate that this will attract more people that are interested in cancer care and also in research. So this is a positive move that we're all looking forward to as staff that work within the cancer services.
Brilliant. And can I ask you one last question, Nia? What advice would you give any nurses thinking of becoming a CNS working in cancer care?
Okay. The advice that I would give to anyone who is looking to becoming a specialist nurse or to become a nurse practitioner is that you should go for it. You should follow your dreams, follow your ambitions. There's so many opportunities that are out there for clinical nurse specialists. It provides you an opportunity to work very closely with patients, an opportunity that perhaps you might not get if you're working on a ward environment, and it is a very rewarding speciality to, hang on, no, don't like that part of the speciality.
Right.
Yeah.
I want to ask you actually a question before that and say, why did you want to become a CNS nurse?
Oh, okay.
And then on the top of the back of that, you could say, so what advice would you give?
Okay,
Yeah.
all right. So why did I choose to become a specialist nurse?
Did you ever see yourself? Is this something you always wanted to do, or is it something you fell into? Or?
Yes.
Yeah,
No, it's okay.
Minutes to think about
That's right.
it.
Yeah, I'll just let them pass. Yeah.
I guess I want to encapsulate with all the like precision medicine treatment or the investment coming into biomedical cannabis in the hospital, the future of cancer care is looking bright, or we're looking forward to it, or something like that.
Okay.
If that's how you feel.
Yes, absolutely. Honestly, it's an exciting time. Really, honestly, genuinely, we're so excited. Right, I just need to compose myself. Oh, is that what you're looking for? Okay, yeah. That genuinely came from the bottom of my heart.
Yeah, things like that. Just something from the bottom of your heart.
Okay.
Okay, yeah. So, what's the future looking like for cancer care, Nia?
We are very excited for our cancer.
We might have to stop.
Oh, that's okay.
Don't worry, we're stopping recording.
Okay.
Whenever you're ready.
Okay. With the new Cambridge Hospital, this is an exciting opportunity for the people that live within the area and far and wide that need to access cancer services in our region. Having all the specialists in one area and also all the facilities that the patients need in one area will hopefully improve the outcomes of the patients that are coming through. From the patient's perspective, we anticipate that having the facilities and the careful planning that has been put in place, the patients are going to find it a calmer, more private environment that will enable them to receive their treatment in a quieter place and in a place that enables them to recover quicker.
And how will the new hospital help staff like yourself?
With the new hospital, with the new cancer hospital, it is going to help staff like myself with having easy access to tests and investigations that are also in one place. It's also going to be a place where we can learn more because we will have all the specialists in one area, and hopefully that will improve the care that we provide to our patients.
Brilliant. Thank you. I know it's really hard.
Okay. So, it's okay. Okay. To become a clinical nurse specialist or nurse practitioner, you need to have excellent assessment skills. You need to have the ability to communicate well with patients. You need to have the ability to formulate a care plan for each individual patient that meets their individual needs as well as the needs of their immediate family. You also need to have observational skills. It's quite important to pick the non-verbal, the things that the patient doesn't tell you directly, because we are meeting patients at a short notice, and you have to try and capture as much information as you can within a short space of time. And they may not be able to go into greater detail, so sometimes you need to be able to use your intuitive and questioning skills as well.
What are the most rewarding parts of your job?
The most rewarding part of my job is knowing that I've been there for my patients in their time of need, and I've helped them through the journey that for most people is the most difficult journey that they may actually face in terms of the changes that they may have to make. And for me, that's the biggest reward and privilege that I could have actually ever be given.
And what do you think of the new Cambridge Cancer Research Hospital plan for the Cambridge Biomedical Campus, which is incorporating research into a hospital space to detect cancer earlier and potentially save more lives?
With the new Cambridge Cancer Hospital, it is an exciting time because all the specialists are going to be in one area. That will hopefully bring positive changes in the way that patients receive their diagnosis in terms of research, but also it will make life a lot easier for our patients that often come from far and wide to access the services that we have here. If everything is in one place, it will make it less stressful for them, but also we anticipate that with the careful planning that has been put in place, the environment in which our patients are going to be looked after is going to be more quieter, calmer, and provide an environment that is conducive to patients receiving the care that they need and also recover quickly.
That was perfect. Do you mind if we do that question again?
Yeah.
So just say, hello, my name's Nia. I wanted to be a CNS nurse because I'm just trying to do different openings.
Okay, yeah, that's fine. Yeah. Hello, my name is Nyarai Chinyama, and I wanted to be a specialist nurse because it gave me an opportunity to just focus and specialize in one area and develop my knowledge within that speciality so I could help patients at a greater length, at a greater depth, and understand their needs more compared to if I was looking after a big group of patients.
Whenever you're ready.
Okay, so within my role as a specialist nurse, there are various other specialities that we work closely with. In surgery alone, there are various specialists. For example, we have colorectal nurses that specializes in lower GI. We have ear, nose and throat specialist nurses. We have specialist nurses that specialize in non-cancer conditions as well as cancer conditions. So there are various specialities that are covered by specialist nurses.
And Nia, do you mind just explaining what a CNS nurse is again, and what a typical day looks like for you.
Okay, so a typical day for a specialist nurse involves meeting patients at the point of diagnosis when they're given their diagnosis, whether that could be in endoscopy, that could be in a clinic setting, in outpatients, or that could actually be on a ward area. We are also involved in organizing investigations for patients when they come through. That could be CT scans, that could be ultrasound scans, anything that they need as part of their staging. We are also involved in terms of communication with patients and their relatives and updating them on the plan of care. As well as doing all these aspects, we also run nurse-led clinics where we actually review patients, and these come in various in various types. Within our specialty, we run a nurse-led follow-up clinic for patients that are post-surgery, and we follow patients up to 5 years. As well as that, we also run a rehabilitation clinic, which is a clinic where we see patients before they come in for surgery, and what we're aiming for is to optimize their health. So there is a lot of things that we do as clinical specialist nurses. We're also heavily involved in research, which is, essential for what we're doing to develop and improve as time goes by.
And how does it feel to be a CNS nurse? Why did you, in your day-to-day role and helping patients?
It's a rewarding profession to be in. Sometimes you have a mixture of emotions. You could move from seeing somebody who has been given good news about the outcomes of their treatment, but equally you could also move on to see somebody else who has been given information that could be life-changing, may not be so positive. So it's all about making sure that these different groups of patients have been supported based on their individual needs. And when you do something like that, it is an honor for people to actually let you into their lives, into their personal space, and be part of that journey, whether you have a positive outcome or not so positive.
And do you mind, Nia, again, just saying, hi, my name's...
Something like within the role of a specialist nurse, there are other specialities, or there are various other specialities, and then...
Yeah, you could say something like being a CNS nurse.
Yep. Sorry, I thought I was waffling.
No, it's
okay.
Great. Just trying to see if we can combine a few questions to make the answers a bit longer now. If I can ask you, what other healthcare teams do you work closely with and why? Do you want to expand that into a bit about how there's such a diversity in CNSs and a bit about the divisions and that sort of thing?
Okay, yeah. So we work with a lot of other professions within our team because our team is multidisciplinary. So we work closely with doctors, surgeons, physiotherapists, dietitians, radiologists. They're all part of our team. But within specialist nursing role as well, there are various other specialities, such as we have stomach care in general surgery, we have colorectal or lower GI. We also have dyspepsia nurses within the upper GI team. So it is a varied, there are various other people that are involved. It's not just one speciality. It's quite diverse, especially in a big hospital like this where we specialize in a lot of other conditions, and being a referral center, you will come across a lot of other specialist nurses within the field.
Joe, just thinking, is that okay there?
Yeah, I was just talking about it as well.
Do you want me to move further?
That's good, yeah.
Yeah? Okay.
Brilliant. Do you mind doing that question?
Yes, please. Yeah, I don't feel like I answered it correctly.
Full name and your role, and then I sort of go into tell us a bit more about your role and who you look after.
Okay.
So you can say, hello, my name is, I need to say your full name, your role, and who you look after.
Can we stand here, just?
Yeah.
I can move away now. You can just stand there.
Okay. My name is Nyarai Chinyama. I am a nurse upper GI I specialize in looking after patients that come through with upper GI malignancies. This could be esophageal or gastric cancer, but we also look after patients with other types of conditions within the department.
Brilliant. And do you mind just saying that one more time? We can have a smile on our face and feel happy.
Okay, all right.
And yeah,
Was I too serious?
forget about what we're doing.
Okay,
But, yeah,
all right,
you
okay.
can be welcoming and smiley.
Okay.
Okay.
Okay, hello, my name is Nyarai Chinyama. I am an upper GI nurse practitioner. I am involved in looking after patients that come through the hospital with upper GI malignancies. These are predominantly esophageal or gastric cancers, but I'm also involved in looking after patients that come through that have got benign conditions, and these can vary from minor conditions to major conditions.
Brilliant. I really like how you explained that as well. You said what GI is. So, and Nia, what kind of situations are your patients going through when you look after them? How are they feeling?
Most of our patients, when they come through, they have a mixture of feelings. A lot of them, they come through because they are quite anxious. They want to find out what the treatment options are available. They want to know what the future holds for them. And also their families are often quite anxious as well. So it's quite a difficult time for a lot of the patients that come through.
And what do you do to reassure and help patients that you see?
Communication is key. Explaining things very clearly to patients, giving them clear directions and advice so that they are well informed. Once patients know what is actually happening, they're less anxious because they know what to expect. Okay, is that all right?
And Joe, that's splashing, is that all right?
Yeah, that's cool.